Any deformity of the calf or the leg are classified into three different forms: either anteromedial, which is associated with the fibular hemimelia; either anterolateral, which is associated with pseudoarthrosis and neurofibromatosis; or a posteromedial, which is termed as physiological. Regarding the fibular hemimelia or a fibular deficiency, it is classified by coventry. Type 1 is when the fibula is shortened. Type 2 is when the fibula is completely absent, and type 3 is when it is bilateral, either shortened or completely absent with congenital deformities. Anyhow, with anteromedial deformity and a fibular hemimelia, I need to examine the patient for a coxa vara, proximal femoral deficiency, femoral shortening, ACL deficiency, hypoplasia of lateral femoral condyle, ball and socket ankle joint, loss of lateral raise, and tarsal coalition. Regarding the treatment, my plan would be to have equal limb length so that the patient can optimally ambulate. This can be done with bracing. This can be done with a supervised neglect. This can be done with operative intervention. The operative intervention can be acute or staged. Acute means that I will correct the deformity and do a plate fixation. That would consist of drawing coras and then finding the angle, the center of angle of rotation, and do osteotomy at that level. Regarding the staged, it would consist of Ilizarov reconstructive surgery. In severe cases, it can be amputation itself.